Welcome to Health Vision. I'm Jackie Wolf, Associate Professor of Social Medicine at Ohio University. Today I'm talking to Dr. Electra Paskett of the Ohio State University Center for Population Health and Disparities about health disparities. Electra, it's nice to see you again.
Thank you, good to see you again.
Let's review what we talked about last week, cervical cancer, because I'd like to review cervical cancer briefly and then talk about how health disparities in our viewing area have affected rates of cervical cancer.
Okay.
So let's talk again about cervical cancer, which we mentioned last week. Rates have gone way down since the 1940s because detection has been so excellent, and in that way we've been able to prevent a lot of cervical cancers.
Right.
And we have a vaccine too. Why don't you review all of that very briefly?
Okay, so last time we talked about the cervix. It's in women and it's at the bottom of the womb or the uterus at the end of the vagina. And we talked about how the Pap test is taken, the two different types of the Pap test.
Which allows us to detect the cervical cancer.
Right, the Pap test allows us to detect cells as they begin to turn abnormal. And if we see those abnormal cells, we can go in and treat the cervix, just that area that's having problems, without the woman needing a hysterectomy, removal of the cervix and the uterus and ovaries, or any surgery. And the woman can be just fine.
And now we're able to prevent cervical cancer completely because we now have a vaccine.
Right. So over 90% of cervical cancer is caused by infection with HPV, human papilloma virus, which gets in to the DNA of the cells and causes the cells to become abnormal as they grow. So the vaccine is to boost immunity against this virus, and has been shown in clinical trials to actually reduce the incidence of cervical cancer or infection from the human papillomavirus, which causes the cervical cancer.
Now, let's talk about the cost of this vaccine. It is quite expensive.
Okay, so the vaccine needs to be given in a series of 3 shots. And the vaccine itself costs a little over $100 for each shot. But there are a lot of places you go to get the shot, there's a fee. There's going to be an office visit fee and a vaccine administration fee. So the highest we've heard that it could cost is $600
for the series of 3 shots.
Of 3 shots total. And now it's new, so some insurances are paying for it right now, except for the copay. Some insurances are looking into paying for it. Some have not agreed to pay for it yet. So yes.
And so most people don't even know if their insurance will even cover it.
That's correct. And it's so new that it's not available yet at all clinic locations. But that should be, progressing so that we can have it available.
So really people should call their physicians.
That's right.
The more people who call, the more physicians will make sure they have the vaccine in stock.
That's right.
Also bug your insurance company.
That's right.
Make sure that they cover, because it is a very, very important vaccine, and its effectiveness is, I believe, close to 100%.
That's correct. And it is, again, for girls, ages 11 through 26. There are some specifications as you get older in terms of if you're eligible, and your physician, will know about that. So it's important to talk to your physician. But it's also important to know that it's to prevent HPV. It's not to treat HPV, and a lot of women misunderstand that.
Once you have cervical cancer, the shot is not going to do you any good.
Once you have
HPV,
and there are certain different types of HPV. And the thought is once you have HPV, if it's a certain type that the vaccine prevents, the vaccine might not be as effective for you.
So this is why it is recommended for girls starting at the age of 11, before they begin sexual activity, because this is a sexually transmitted virus.
That's correct.
That's why they need to be vaccinated at that young age.
That's correct. And last time we talked about the fact that no, this is not a green light for girls to become sexually promiscuous. That's not what this means.
This prevents an illness like any other vaccine.
That's correct. And cervical cancer should not be looked upon a disease of promiscuity. That, almost 80% of people who are sexually active, men and women, will one time in their life be infected with HPV.
And we should also say HPV comes in many, many strains.
Correct.
It causes all skin warts. It's a very, very common virus that humans carry with them.
That's correct. That's correct.
But the two forms of HPV there are 2 forms, right, that cause cervical cancer are sexually transmitted.
That's right. And that is how one contracts.
And we should mention too that it's being tested on little boys as well, since they are carriers. At some point, it might be recommended for them as well.
That's currently in clinical trials right now.
Yeah, since they transmit this to girls.
That's correct.
What interested you in this? Because a lot of your research is on cervical cancer. What interested you in this research?
Well, specifically, many years ago, when I was working on my doctoral dissertation, I was looking at the problem of follow-up of women who have a positive Pap test result, and trying to understand why women who have an abnormal test don't come back for prompt and proper follow-up. Nationally, actually worldwide, it was only about 60% of women who have an abnormal cervical smear, an abnormal Pap test, will come back when they're supposed to. So I did some research to understand why, and designed an intervention, a brochure that can be mailed to women when they get their test results back. Because the problem is that you get your Pap test and then usually you get a letter back. It either says everything's fine, see you next time, or you can get a letter or a call saying we found some cells on your Pap test that looked different. We need you to come back and get a colposcopy. So women are like, well, what is that? Well, few women can pronounce that.
It also sounds like colonoscopy,
That's right.
which a lot of people are also very, very
That's
afraid
correct.
of, where your colon.
That's
yeah.
right, but this is a colposcopy. So the colposcopy scope goes in the vagina and has a little scope on it that allows the physician to actually visualize the cervix. And the physician can see where there's any problems on the cervix and actually then treat the problem by freezing that or taking that piece off of the cervix with minimal pain or problems.
So the colposcopy, did I say it right?
Yes.
This is not a diagnostic treatment. This actually is this is a treatment.
It
it's not just a
diagnoses
diagnosis.
and treats. And so with the scope, so the physician can look in the scope is inserted in the vagina and visualize the cervix that we talked about looks like this, and can actually see if there's abnormal cells, and then can take a piece of that and send it off for biopsy, can actually remove that whole section, can freeze that section as a treatment, etc.
And this is done as an outpatient treatment.
Right, in the office.
And it's virtually painless.
Yes. A little cramping, when that's done, but virtually painless. And so women don't understand, don't know what they're supposed to go back for, don't understand the need for going back. And so we explained that in this study that I did.
Let's talk about cervical cancer specifically in this area, in Appalachia. We talked about how expensive this is.
The Gardasil test.
The Gardasil test, that's right. Treatment is expensive. I'm sorry, that's not treatment, it's prevention.
Right.
The immunization is expensive.
Right.
And even people who have health insurance might not be covered.
Correct.
Now this is, in this area we have very high poverty rate, and the rates of cervical cancer are also higher than the national average.
Right. When I first moved to Ohio, the National Cancer Institute produced a monograph that showed the map of the United States with rates of cervical cancer deaths among white women. And two areas popped up all in red. Red is bad. Usually OSU, we like red, but in this case, red was bad. So the one region was along the Texas-Mexico border, very high rates. The other place in the country was along Appalachia, including Appalachia, Ohio. Red rates, bad. High cervical cancer death rates in Appalachia, Ohio.
Do we know why?
So we applied for a large grant, which we were able to get, called the Center for Population Health Disparities, funded by the National Cancer Institute, to understand why we see high rates of cervical cancer in Appalachia, Ohio, and can we do something about it? So we know that there are three reasons for this. First reason is lack of screening, lack of use of Pap smear screening. So one of our projects addresses that.